Good evening, all my dear students. Welcome to our OET online virtual platform from B-GHUD family. It's me, Abhilash Vijay Mohan, a senior faculty from B-GHUD Academy. So I welcome you all on family, B-GHUD family. So I think all are doing good, keeping healthy, fine, fit, and all are doing comfortable. Okay, so once again, I welcome you all. So let's join us for today's class so that have an interesting speaking session. You can make it use for your OET examination and can apply for your flying to your dream destinations. Fine. Okay. So hope all are doing good and fine once again. Okay. God bless you all. My prayers and wishes for all OET aspirants and students those who are watching me. Okay. So let's start discussing things. I have not got any queries related to our concerns, and so no question has been sent to me so far. So let me discuss the question. Let us discuss today's OET role play so that you can make use of this is our 38th live session. So we'll be continuing with more sessions. Try to make use of all these things. See how to appraise the question, how to develop dialogue, sentence structure, question structure, or intonation, how to express these things, and learn and practice. Okay, you should have to see, you have to practice and make it useful for your future. Okay, so those were applying for your migration. So those are planning to take OET, make use of all these classes. Okay, so once again, welcome you all onto virtual platform. So my first participant is there, my dear Bonnie. Good evening, Mane. God bless you. Okay, thank you. So, okay, so now the question will be displayed. You can have a look onto the question. Yes, the question is right displayed there. Please have a quick look onto the question. Let's discuss the role play further. Yes. Oh, let's start discussing the question. See, the setting here given is a hospital ward. You see a 40-year-old patient who had a catheter insert in a hernial repair. Had the catheter removed 6 hours ago, and you are monitoring bladder function. Okay, find out how the patient is feeling, any pain, whether past, urine, etc. Okay, so this is a non-case. Okay, I want all of you to know one thing. These all are exam-related questions. We are not taking out of books, anything. These all are exam related questions. You can have a look onto this. You can read well, you can practice well, and can make it useful for your reference. Okay. So these sort of models will definitely you can expect. So if you practice all these topics, definitely you can fetch an A band for your examination. Okay. Okay, my dear students. So this is a hospital ward, a non-case patient is has finished hernia repair. Catheter has been inserted. Okay, so the catheter was removed 6 hours ago, and we are now monitoring bladder function. So to see the efficiency of bladder, to monitor the efficiency of bladder function, we have just removed the catheter, and we are just seeing how the patient is having the output after this catheter removal. Okay, so we are assessing their function. So find out how the patient is feeling. Known case. So you can collect the name during the preparation time and can display the and can ask the patient like how they are feeling, whether any pain or whether they have passed urine. Okay, find out more details about pain. So the patient would be reporting pain. So we need to ask more like onset of pain, whether they have tried any treatment. Explore the patient's hydration regarding water intake, fluid intake, like quantity, time of last drink. Okay, all those things we need to ask. Explain the purpose of trial without catheter. So why we have planned this trial? Okay, without catheter, why we have planned trial that we need to explain them. That means it is to ensure the bladder function restored. We need to see whether after this hernia surgery repair and all, whether the patient has restored their bladder function. To assess that, we are doing this trial failure. Unfortunately, the trial is a failure because no urine was there for past 6 hours. That means no past for 6 hours. Outline next step. So all would be very anxiousness would be down. Patient would be also very anxious. We need to outline the next steps like reinserting catheter, Discharge with catheter bag, retrial within 1 week. Discharge will be there. Reinsertion is must. Discharge will be there, and at the same time, there will be a review and retrial after 1 week. Okay, these are the things that we need to explain them. One, the patient possible risk of not reinserting the catheter. Okay, so the patient would be almost fed up with this catheter, so they would be reluctant, they would be hesitating to go for denying further reinsertion. So, but we need to explain them what are all the side effects or the after effects if catheter is not reinserted. What are the complications? So, okay, what could happen? Risk. Okay, give details of catheter management. So when they ask their concern regarding catheter management and all, try to give them an explanation like ease of emptying bag, community nursing support can be available. Okay, establish patient consent for catheter rates. Maybe we should somehow get the patient consent for again inserting the catheter. Okay. Last task is inform the patient of time scale for returning to hospital. So when to come back after this reinsertion of catheter, they will be discharged. The insertion will be there, they will be discharged, and when to come back means after 1 week to remove the catheter, and there will be the catheter, the trial without catheter will be repeated. Okay, advice to return soon if worried or like increasing pain. So we can ask them to normally they can come back to our clinic after 1 week for a retrial, for again a retrial. In case if they have got some worries, moves or concerns, that means increased pain or comfort, we can ask them to come as early as possible. Okay, as the moment is suggests. Okay, they can come at the moment that they experience all this discomfort. So regards the topic, it's quite a simple topic. Sort of communication should be that much effective. A natural sort of communication should be displayed by all of the students so that you can fetch a very good band and easy band. Okay. I think the question is clear to all my dear students. If you have got any queries or concerns, means you can throw it on the comment box. You could pin your suggestions over the comment box so that I would be able to clarify that. Okay. Any queries or concerns, any doubts regarding the question means you can just give it to me. Yes, my dear students, all of you. I think everything is clear. So let us start anyway. I'm not getting any inquiry. I think all my students are watching me. So I know that you're quite shy and inferior. See, actually, the shyness and inferior won't help you the long run. You should come out of that. Feel free to ask so that it will be a sort of inspiration for me and encouragement for me. Okay. So keep us enthusiastic by your comments. So if you can pin your comments over the suggestion or in the comment box so that I'll be able to clarify all those things, my dear students. Right. Okay, so let's start. No queries so far. Yes. Find out how the patient is feeling. So that condition. That case is a known case. We're taking some name. You can call the patient Mr. Peter. Okay. Good morning. Oh, Mr. Peter. Good morning, Mr. Peter. I'm your nurse here. Okay. Good morning, Mr. Peter. I'm your nurse here. How are you doing? How are you feeling since the removal of catheter? Is everything going on well? Do you have any pain or other discomforts? Okay. So this is how we can start. Good morning. Good morning, Mr. Peters. I'm your nurse here. Yes. How are you feeling? How are you feeling now? Like, how are you doing? Or how you're feeling now? Okay, how you're feeling since the removal of catheter? Is everything going on well? Okay. Do you have any pain? Okay. Do you have pain or do you have any pain or other discomforts? Okay. So the patient will be answering to that question and again you're asking, what about urine output? Did you urine? What about urine output? Did you pass urine? Did you pass? Okay. So the patient would be saying like pain is there and patient hadn't passed urine for pass. Okay. Passed. Well, I know that's terrible. Okay, I know that's terrible. It is tough to have pain. Well, tell me, when did it start? Well, tell me, when did it start? We are asking about pain. Well, tell me, when did it start? Okay, did you try the medicines given? Have you tried any remedials or have you tried any treatment? Oh, okay, did you take the medications that we have prescribed? All those things. Okay, did you try any remedials for that? All those things. Asking with the patient. So they will be asking to the. Okay, tell me, when did you have your last drink? Okay, tell me, when did you have your last? When did you have your? When was the last drink? You can ask like that. Okay, before that, the quantity. Okay, how many drinks of water? Okay, what was the quantity of water that you consumed? Tell me, how much volume of water did you consume? How much volume of water did you consume? Or how many glasses of water did you consume? Okay, so that will be, they will be giving you the answer. Okay, when was the last drink? Next is like time of last drink is like when was the last drink? When was the last? Okay, how much volume of water did you consume? How many glasses of water did you consume? When was that last one? So these are all the sets of questions that we can ask there. So the patient would be giving you answers to all those things. Okay. So now we are coming to the task like, yes, thank you for answering me. Now it's a lot more clear. Thank you. Thank you for answering me. Now it's a lot more clear. Well, Mr. Teacher, okay, well, teacher, actually this was a trial. Okay, we have removed your catheter as a part of trial. This was a part of trial. We removed your catheter. Okay. We were seeing whether you have restored your bladder function. We were seeing that you have restored your bladder function. We were seeing the bladder efficiency. Okay. Okay. So that is how we are just asking. Like this was a part of a trial. This was a trial. We were seeing your now bladder efficiency. This was and we'll see whether you have restored your bladder function or bladder efficiency. Okay, so this is a trial. Okay, after surgery, we are seeing all those things. Okay, this was a part of trial. Okay, this was a trial. We were seeing whether you have restored bladder function or bladder efficiency. Your output we were monitoring, and unfortunately the trial was a failure. So that punch you should say. And unfortunately, the trial was a failure. I'm sorry. Okay, unfortunately, the trial was a failure. Trial is a failure. And unfortunately, the trial was a failure. Sorry. So the patient would be saying like, unfortunately, the trial is a failure. I'm sorry. See, there was no urine output for past 6 hours. See, there is no urine output for past 6 hours. See, there is no urine output for past 6 hours. Um, so they'll be saying like, oh knows what you're going to do next. I don't know. Please don't be scared. Now the definitive option available is a reinsertion of catheter. Please don't be anxious. Don't be scared. Now, definition available is reinsertion of catheter. Reinsertion of catheter. Okay. So they will be asking about discharge. Please don't worry. Your discharge will be done. Please don't worry. Never, nothing to be overly concerned. No concerns. No worries. Your discharge will be there. Okay. There won't be any issues with the discharge. Your discharge will be given. There will be a trial again after 1 week to see that to monitor the bladder function. But there will be a trial after 1 week for monitoring to monitor the bladder function. You have to be here at the correct time. Will that be okay for you? Okay, so yeah, just like okay, now the definitive option available is definitive management available is the insertion of catheter. Uh, we need to put the catheter back in. So the person who knows I'm very worried what about discharge. Please don't worry, your discharge will be given. You can go home with this catheter and you go back. But make sure that you are here after 1 week for again 1 week for another one trial. Okay, another trial. Okay, make sure that you are here after 1 week for another trial to see the bladder function. Okay, and the trial will be done after 1 week to see the bladder function. Make sure that you are here. Okay, make sure that you are here for another trial for 1 week. Make sure you are here after 1 week for another trial to see the bladder function. Okay, that's all. Okay, okay. So we are just informing the patient. So the patient will be asking like, oh nurse, what will happen if this catheter is not reinserted? Means I'm really not fine with, I'm not doing well with this catheter. So please just tell me what will happen if there is no catheter. Okay. So I value your feels. I know why you are saying like this. I know why you're feeling this way. It is usual. See, as I mentioned, this is definitive option. There are no two ways about it. In case if this catheter is no in case if the catheter is not reinserted, in case if the catheter is not reinserted, the risk for bladder infection, the risk for urine retention and bladder infection will be more. Okay, the risk for urine retention, the risk for, okay, in case if the catheter, if there is no tree inserted, it may result in bladder, it may result in urine retention, it may result in urine retention and can cause urinary infection In case if this catheter is no tree inserted, it may go for urine retention and finally, and bladder infection. Okay, it may go for urine retention and infection. Okay, that can be very dangerous. It may spoil your health. Um, it may spoil your health as you have undergone a major surgery. It may spoil your health as you have completed a major surgery. So you finished a major surgery. Okay, the risk would be more in this case. The risk would be more in this case. Are you getting me? Okay. Are you getting me? So they'll be saying like, yes, nurse, but I really don't know how to take care of all these things at home. I understand. I understand. I know it would be very difficult for you at first. We will be giving. I understand. I know it would be very difficult for you at first. We will be giving you all the informations on how to take care of catheter as well as urobac management. We'll give you all lessons on catheter care and urobac management. You may find it difficult at first. Eventually, you'll get used to it. You may find it difficult at first. Eventually, you will get used to it. You may find it difficult at first, but eventually, you'll get used to it. Okay, you may find it easy. Trust me. You may find it easy. Trust me. Okay, you're just telling the patient, right? Okay, we will be giving you all instructions regarding that. Okay, and nothing to be overly concerned about. I could arrange our community nurse to come to you, and nothing to be overly concerned about. I could arrange our community nurse to come to you, our community health nurse to you, so that they will assist you in urinary bag management and catheter care. Okay, they will assist you in this procedures. Okay. And you don't have to. I could arrange our home health nurse or our community health nurse, to come to visit you. They will assist you in this catheter care and they will assist you in this procedure. You can seek their help in managing catheter and urobag. Okay, so this is how we can explain our sayings to the patient. Fine. Okay. How does that sound? Is that an acceptable plan for you? Okay. How does that sound? Is it an acceptable plan? So they'll be saying, like, oh, nurse, please ask the committee, help nurse to come to me. I want their help. So you can say, like, sure, I will definitely inform the nurse community. Okay, nurse and community center. Okay, stay confident. Stay confident. Okay. Yes. Well, how do you feel now? I hope you are quite confident now. Are you ready to get the catheter reinserted? Well, hope you're confident now. Okay, well, how do you feel now? Are you confident enough to get the catheter reinsert? Okay, shall I go ahead with the catheter reinsertion? Shall I go ahead with catheter reinsertion? Shall I go ahead with catheter reinsertion? Are you ready? Are you ready? So the patient will be definitely saying, yes, nurse, I am ready, nurse. So, great. Glad to hear that. Thank you for your patient listening and understanding. Great. Glad to hear that. Thank you for your patient listening and understanding. Great. Glad to hear that. Thank you for your patient listening and understanding. Okay. Now the catheter will be, I will discuss the issues with the doctor and we'll get back to you soon. I will discuss the issues with the doctor and will get back to you. Soon the catheter will be reinserted. You will be discharged. Okay, you'll be discharged. But as I have already told, please do be here after 1 week. Please do be here after 1 week. Okay, there will be again a trial to see whether you have regained your bladder function. Okay, there will be again a trial to see whether you have regained your bladder function. If that's successful, if that is successful, then definitely you will be freed of catheter. Okay, if that is successful, you will be definitely freed from catheter. Okay, if that is successful, definitely you will be freed from catheter. Okay. So the patient would be reflecting definitely agreeing there. And please listen, Peter. In case if you experience some discomforts before, okay, and see, Peter, in case if you've experienced some other discomforts before, or some unpleasant or unusual sensations before, like increasing pain or other discomforts, never delay, get back to us. Okay, get back to us at the moment. Okay, get back to us at the moment. And listen, Peter, in case if you experience something worrying, something unusual or unpleasant, like pain, shortness, or any other discomforts, never delay, get back to us at the moment. Get back to us at the moment. Are you getting me? Are you getting? Okay. Well, how do you feel now? Are you confident? Yes. Is there anything else that you would like to ask or discuss? Yes, the patient will be saying, right? No, no, so everything is clear. Thank you so much for explaining me all these things. Okay. In case of any queries or concerns, please feel free to ask. Definitely we will help. In case of any queries or concerns, feel free to ask. Definitely will help you. Okay, so the patient will be saying like that. Thank you. Thank you once again for your patient listening and understanding. Thank you once again for your patient listening and understanding. Now you may please take rest, feel relaxed, feel comfortable. I'll get back to you after consulting the doctor. I will get back to you after consulting the doctor. Okay. Get back to you after consulting the doctor. Relax. Relax. So we have to inform the trial repeat. Okay. The repeating trial, we need to inform them. That context, we are just finishing the statement and we are leaving to the okay. We will please feel comfortable for this. I'll get back to you after consulting the doctor. Okay. I'll get back to you. So after consulting the doctor, please relax. Relax. That would be the end. Okay. I told you, no, there is nothing like some conditioned or some set rules are not there for introduction and conclusion. That is your wisdom. So try to make the introduction and conclusion more attractive and unique by giving some dialogues, which is an excellent fit for the situation. Okay, so never rely only on this traditional, customized dialogues. Try to come up with some decorated dialogues. Okay, that should be an excellent fit to the present to the situation too. Okay, that you have to take great care. Any queries or concerns, please you can throw it on the comment box. Okay, if you have got any questions or any particular concerns to discuss, please throw it on the comment box. Our quality control team is checking that. We will definitely answer to all those questions. Okay, thank you for staying tuned. Thank you for watching me and try to like and subscribe this, share them out those who are in need. Okay, so all my students, all my dear students, all my very best wishes for all my dear students, or dear parents. Okay, may God bless you all to come into flying. Okay, may God bless you all to fly into wearing hats with multicolors. God bless you all. Take care.